From Kano to Abuja, where a federal high court has granted the suspended Accountant General of the Federation, Idris Ahmed, and his co-defendants bail upon terms and conditions given by the Economic and Financial Crimes Commission. Delivering ruling, Justice Adeyemi Ajayi ordered that the defendants shall not leave the Federal Capital Territory, and if they want to, they would have to seek clearance from the court or have their bail revoked. The court also stated that the defendants shall sign an undertaking that they will abide by the bail conditions. However, prosecuting counsel Rotimi Jacobs expressed displeasure over the court's leniency in granting bail to the defendants by adopting the terms of administrative bail earlier granted. But the Economic and Financial Crimes Commission says it has opened its case against the former AGF. Ahmed Idris and his co-defendants have been in and out of court within the last 2 weeks following a 14-count charge bordering on theft and criminal breach of trust to the tune of 109.5 billion naira preferred against them by the Nigerian government. In Kaduna, the Nigerian Defence Academy, in collaboration with the University of Ibadan, has now set up a Center for Early Warning Studies on Security. The center, which has hubs in NDA and University of Ibadan, will provide a robust database on threats to national security and also collect data on the causes and incidences of insecurity in Nigeria. Lupi Assam has details.
Nigeria, together with other African countries, is grappling with various security threats. Over the last decade, it could be observed that internal conflicts have replaced international conflicts and new security challenges have continued to emerge. Among them, occurrences of pandemics, youth vulnerability and exclusion, terrorism and asymmetry warfare, and others. The NDA, being Nigeria's leading military research institute, is deepening debates among scholars to come up with solutions to these issues. That is why it has organized this 2-day international conference themed Defense, Security and Sustainable Development in Africa.
This conference will address the dynamics of and nexus between defense, security and sustainable development.
My overall argument is that Africa has the resources to meet its needs and its demand of this population. Not for speaking esoteric economic language which nobody understands. We must speak the language of sustainable development which everybody understands.
At the conference, a Center for Early Warning Studies is unveiled. This is a collaborative effort of the NDA in Kaduna and the University of Ibadan in Oyo State. The center will provide a robust national database on threats to national security.
The center will collect remote and longitudinal data on the causes and incidences of violence, criminality, terrorism, and insurgency in Nigeria, with a view to alerting relevant stakeholders on the potential dangers and guiding them to take appropriate actions. This center will have 2 main research hubs in the University of Ibadan and here in NDA, serving the southern and northern regions of the country respectively.
In recognition of the NDA Commandant's contribution to peace building, he is conferred with the honor Fellow of Society for Peace Studies and Practices. Over 200 postgraduate students and final year cadets are also inducted into the society. Lupe Assam, TVC News, Kaduna.
And now to judicial matters. It's some relief for the family of Hanifa Abubakar, the murdered 5-year-old pupil of Noble Kids Academy, as a Kano High Court today sentenced Abdulmalik Tanko and Hashimo Ishaku to death by hanging for finding them guilty of kidnapping and killing of the pupil. They were charged on 5 counts of criminal conspiracy, attempt to kidnap, abatement, kidnapping, and concealment of truth. The offences contravened the provisions of sections of the Penal Code, Laws of Kano State, 1991. In his judgment, Justice Usman Naaba sentenced Abdulmalik Tanko to death by hanging and 5 years for conspiracy. He also sentenced Hashim Ishaku to death by hanging and 2 years for concealment and kidnapping. The court also sentenced the third defendant, Fatima Jibrin, to 2 years imprisonment for attempt to kidnap and criminal conspiracy. The 5-year-old Hanifa was abducted by Mr. Tanko, who demanded ransom from her parents and was reported to have killed her in December last year. And still talking health, about 300 physicians from 13 countries in West African sub-region are advocating improved infrastructure to build a functional healthcare system. Bamidele Ajayi has more.
An average of 20,000 Nigerians travel to India each year for medical assistance due to the absence of solid healthcare system back in the country. UNICEF recent survey disclosed that preventable infectious disease such as malaria, pneumonia, diarrhea, measles, and HIV/AIDS account for more than 70% of the estimated 1 million under 5 deaths in the country. The country health sector is confronted with many problems, including poor hygiene, corruption, poor health infrastructure, fake drugs, insufficient financial investment, and inadequate health personnel due to annual medical brain drain. At the annual general and scientific meeting of West Africa College of Physicians, Nigerian chapter held in Enugu, the physicians enumerate successes recorded in the area of training of practitioners.
The brain drain, we will know, is an economic problem, and that is an issue that government should handle. On our side, we have continued to train high-quality physicians.
The medical specialist body appealed to government to address issues that are not within the college mandate. They reaffirmed the commitment not to lower the standard of manpower, but appealed to government to address the economic problems that encourage medical tourism.
So we will be appealing to government to ensure that they put in the tools in the hospitals, because we have already trained people with enough competencies that they will also get abroad that they are getting here. And I think you can see the recent example of the vice president. Yeah, these are the, once we put the tools in place, the people we train have the competencies to deliver.
We have people from Ghana coming to Nigeria, Nigeria coming to Ghana, and Exeter, and vice versa for health tourism. In Nigeria, there are centers of excellence. That is also something that the government must look at private-public partnership.
The event is expected to have 300 physicians who will interrogate the emerging challenges in fragile conflict areas, vaccine hesitancy, and universal health coverage. They will also make recommendations that will halt brain drain in the sub-region. Bamidele Ajayi, TVC News, Enugu.
It's the World Hepatitis Day, and it's a day set aside by the United Nations Organization to raise awareness on the global burden of the viral disease. According to the World Health Organization, over 350 million people are living with viral hepatitis, and it accounts for over 1 million annual global deaths. In Africa, the global health body estimates that more than 91 million Africans live with the deadliest B or C strains, and that Nigeria accounts for some 19 million of the figure. The theme of this year's commemoration, Bringing Hepatitis Care Closer to You, seeks to bring care closer to primary health facilities for the public to have better access to treatment and care. Hepatitis is an inflammation of the liver, which can be prevented through the use of sterile injections, safe sex, and vaccination, among others, with a global target of 2030 set by global partners to eliminate the disease. Let's talk now.